Vi Emma, Sine, Ida og Amanda i podcasten Folkefeber. Vi har som mål å lære mer om sosiale ulikheter i helse, og i denne sesongen gjør vi det ved å utforske norsk-somaliere under koronapandemien. I siste episode svarer vi på dine spørsmål og kommentarer til tematikken, så send inn meldinger til oss på sosiale medier underveis i sesongen. Folkefeber har fått stipend fra Senter for bærekraftig helseutdanning.
That was the introduction to our podcast, Folkefeber. My name is Amanda, and with some others on this project, I will present our podcast that is supported by She. First, I would like to introduce our group, and we got to know each other exclusively because of our common interest in social medicine in a reading group created by Untitled. And I would say that we're a quite engaged group. My name is Amanda, and I'm a third-year medical student, and I'm also a research school student with a project about antibiotics use in Palestinian refugee camps. And I'm also active in the Solidarity Youth in Norwegian People's Aid. And next to me is Ida, who is also a third-year medical student and a research school student with a project about the biomedicalization of death. And together with Sine, to the far left, Ida was in Uganda and Rwanda on a social medicine course. And next to Ida is Emma, who's a last year medical student, and she has done the research school and has also been the leader of Medhum and worked for the UN in Jordan. And next to Emma is Sine, who's a third year medical student, and she's applying for the research school with a project about antibiotics use in Tanzania. And Emma couldn't be with us on this presentation, but after I have talked about our podcast in general, Ida will speak more about sustainability, and then Sine will talk about things we've learned during this project. So that was us. Now over to the project. Folkefeber is a podcast about inequity in health. And this season, we investigate this topic through the example with Norwegian Somalies during the corona pandemic. And our dream is to make several seasons of Folkefeber with different topics that are related to inequity in health. And Folkefeber is a Norwegian expression, and it can be translated to meaning a fever that can affect everyone in a society, like COVID. So why this topic? When we saw this She announcement in May and we read the vision of She, we knew that we wanted to apply, but we didn't have a project yet. And at the time we were in this reading group, the four of us and Anne, and we read a book about Mexican farm workers in the US. And we discussed topics like racism, ethnicity, class, social inequality, inequity in health. And these topics really engaged us. And at the same time, approximately, the statistics came on the 1st of April that showed that Norwegian Somalies was the most affected group by COVID in Norway. And then the idea came to create a podcast investigating this topic and how this happened. So we applied to She and we got the scholarship, and then we started making episodes. So we have made 8 episodes where we interview people that played a role during the COVID pandemic among Norwegian Somalis in Norway. And everyone we asked to be interviewed actually said yes. So we are so happy with all the interviews, and we've interviewed very interesting and important people in Norway. And we've interviewed a patient, an activist, a doctor, a journalist, a district medical officer, or bydelsoverlege in Norwegian, and the Norwegian Institute of Public Health, or Folkehelseinstituttet, a politician and a change maker. And we will also create a Q&A episode where we answer questions from the listeners. And we are also working on an article for a journal or for a newspaper. So our aim for this podcast is divided into First, we want to increase knowledge in social medicine among medical students and others. And this includes showing that inequity in health also exists in a rich welfare country like Norway. And secondly, we want to contribute to create change makers among medical students and other health workers. And by change maker, we mean a person that dare to speak about inequality and that fight for equity in health. And I also want to take this opportunity to brag a little bit because we have released 3 episodes by now, and we already have 822 playbacks, 206 listeners in 10 different countries.
Thank you. So first of all, I'd like to say that this year's corona crisis already clearly illustrates the necessity of a Center for Sustainable Healthcare Education. It is clear that the changes this pandemic has provoked, as well as the disease itself, strikes differently in the different socio-economic classes. When the crisis first arrived in Norway in March, we, as future healthcare professionals, felt unequipped when faced with this inequity created and worsened by the pandemic, which so clearly manifested itself in health. The medical education, as it is in Norway today, focuses more on exposing the problems of social inequity than on helping us to become change makers ourselves. This left, at least the 4 of us, with a feeling of powerlessness and frustration. There was very little empowerment. We believe that it is time for our education to enable us to reflect critically over the health systems and healthcare professionals' parts in creating both social equity and inequity, as well as give us the tools to see our own influence and ability to create a more just and sustainable healthcare system for future Norway. As healthcare professionals, we are in the unique position where we can contribute both directly on an individual level with our patients and in our local environment, but also on a higher structural scale with the trust and knowledge the role brings with it. The goal of our podcast project is to take our education from information discovery to change making. We want to show how one can take a step further from acknowledging the problems to seeing opportunities and gates to change, both locally, nationally, and globally. With She's help, we wish to spread knowledge and create tools that can help both medical students and others in Norway to go towards becoming change makers. In many ways, we are attempting to create a step-by-step guide in thinking systemically throughout the podcast episodes. We believe that we, with this, can contribute to She's goal that the UN sustainability goals become a naturality in future decision-making within health. If it is when facing pandemics like this, antibiotic resistance, or the major demographic changes we are facing in the future. Our main areas of focus to further this superior goal to make health more sustainable is to figure out 1, how can one recognize problems within health caused by social inequity? How does one take a critical stand to simplified explanations from the media and the health system itself? And 2, how can one analyze the social, economic, political, and health aspects with this, which this inequity has risen from? Here, we want to do an analysis across the sustainability aims. And thirdly, how does one take the step further to explore effective interventions? Which parts should take part in such a discussion, and how does one consider these interventions based on sustainability? And lastly, how can and should one analyze the power relations that creates both gates and barriers for implementing change? How does one map one's own network and possible influence? By touching on the themes, systems thinking, future orientation, and normative competency, this project will address many of the key competencies within UNESCO's framework for sustainable education. We want a shift in paradigm within our own education and are confident that this project will create ground for a new and future-oriented focus on change and sustainability in the social medicine education. We are inspired by our co-students worldwide who takes a stand for a more just healthcare system, both within and outside the frames of the ongoing pandemic, and are extremely grateful for receiving the confidence to attempt at creating change at our own university as well.
So I am going to speak to some of the aspects of what the podcast has revealed. We wanted to explore what fundamentally caused Norwegian Somalians to be disproportionately affected by the pandemic. The people we have spoken to have had many different roles and points of view during the pandemic and among Norwegian Somalians. There is a certain agreement on what on some of the causes but some have also been surprising. For example, that it was Norwegian Somalians themselves, for example, Ayaan Bashir, that you can see on the picture to the left here, who asked for the numbers revealing place of birth for the people infected on April 1st, numbers that have been widely debated. She knew it would cause discrimination. Still, she thought the numbers were important so that it could be justified putting in extraordinary measures towards the population. Communication and information have again and again been mentioned as the main causes of the spread of infection, and it is probably a part of the explanation. To simply put out information in Somalian at the website of the Norwegian Institute of Public Health and the municipality of Oslo doesn't really work. To communicate in an efficient way, you need to know your population. Ayaan Bashir is a Norwegian Somalian and a doctor, and knew that other communication measures needed to be made. So she started making videos explaining the virus. To the right here is Faisa Vasame, who talked about the importance of what she called the jungle telegraph. Faisa uses the term jungle telegraph to describe the way they use big WhatsApp groups to provide information that reached Norwegian Somalians. These two women were also the initiators of the Somalian Corona telephone, because the public Corona telephone was not staffed by people with the necessary language fluency in Somalian to answer the Norwegian Somalians' questions. Faisa describes it as her duty and a calling to do what she could for her community. The fact that this Corona telephone never received any funding despite the very important job that they did is worthy of criticism and is basis for a debate on what the public and what volunteers should be responsible for during the pandemic. The press has provided information to all Norwegians during the pandemic, and we're quick to describe the numbers on country of birth when they came on April 1st. Fredrik Solvang, whom you can see to the left here, think the Norwegian Institute of Public Health did right by releasing the numbers, and says that the media should always tell the truth. But what responsibility does the press have in providing context and nuanced explanations, and how should they write about an already discriminated group like Norwegian Somalians? There might not be a right answer, but the debate is important. We also talked to Marianne Borgen, whom you can see to the right here, about what we know about our city, the city of Oslo, and about the people who live here. To provide good measures, it has been essential to be knowledgeable about the Oslo population, but there is a lack of knowledge. We know a lot about overcrowded housing, which several times have been brought up as one of the main reasons for the high numbers of people infected among Norwegian Somalians. Knowledge about minorities and their use of healthcare services is lacking. And as an example, and some of the assumptions that have been made have not been correct according to the research that have been done. An example on that is that most people have assumed and written about that Norwegian Somalians have more chronic diseases than the general public, but the research provided by the Norwegian Public Health Institute actually says the opposite. Norwegian Somalians have fewer chronic diseases than the general public in Norway. Ibrahim is a Norwegian Somalian who became infected with corona. You can see him to the left here. And he describes in the first episode that it boils down to structural causes that were present long before March 12th. He describes that he experiences racism in his everyday life, and that it sometimes feels like he's digging into a brick wall with a spoon trying to stand up against it. Ibrahim works as a taxi driver, but is actually an architect. That illustrates one of the most fundamental causes we've been able to explore in this podcast, socioeconomics. Camilla Stoltenberg and the Norwegian Institute of Public Health launched a report in July that, among other themes, highlighted how socioeconomics have played a role during the pandemic. We can talk a lot about the big and small causes that contributed to the spread of infection in the beginning of the pandemic, but we are pretty sure socioeconomics is in the very core. We talked to Embla Mathisen, the leader of Changemaker, about that, because we don't just want to talk about the causes of this issue, we want to inspire to change. Whether or not the podcast has done that, we have yet to conclude, but it has already sparked interesting conversations and discussions, and we hope it will continue to do so. A sustainable healthcare service must be equipped to take care of the needs of the entire Norwegian populations in the future, and we hope that our podcast will contribute to that. Thank you to she, and thank you for your attention.
Thank you so much for this. It's very inspiring to have students with this kind of approach. Really looking forward to it, and I think you will also be pioneers and change makers towards recruiting more students into this. We will now get a few comments from one of the mentors in this. Anne Kveimli already mentioned. Among the staff at the medical faculty, Anne is one of the driving forces for development of our educational programs, and in particular to align the curriculum better to the societal need. Please, Anna.
Thank you. Oh, I'm so proud of these students. I mean, it's just incredible. And I encourage you all to listen to that podcast, because the episodes that are out now is just mind-blowing. So it's incredible interviewing, it's well thought through, and it's also, in addition, they've also made this fantastic broadcast. So they've managed to actually make it being listened to, which I also think we should credit in this perspective. So I think, I mean, we in the medical faculty, we are surrounded by bright students, but we do not take enough advantage of them, and there's a lot of talent being spilled because we do not actually equip them with the right tools to make these kind of things that Amanda, Sine, and Ida and Emma have done here. So I think, I mean, I'm really grateful for this center, not only for giving the students the possibilities to produce podcasts, but also to giving us as teachers the more power behind our wishes to create an education more in line with the new sustainability, more in line with the current the demands of the current world. And there's a lot of us who want that, but it's really difficult to make that happen. And I just want to show you a slide. So sorry about that. Why do I get Trine? Why do I get okay, there it is. So now you see a wrong. So, because my argument is that is, I mean, changing curriculum in medical school is moving a mountain. I might be taken to mean that it's impossible. I don't mean that, but it's really, really difficult. And I think that she has to know that in order to be able to create change in the curriculum in medical schools. Because it's really, and I think you know that, but it's really hard because, and the reason why I'm saying this is that I have gotten some requests from students who have produced things for SHE and been asked whether I could introduce that in my teaching or in our curriculum. And I mean, for this group of 4, that's easy because it fits perfectly well into what we are, many of the things we are teaching and actually, or I'm teaching, and actually more than I thought. So for instance, this thing of advocacy, and the importance of including the groups that you are engaging with, both in population samples and individually. I mean, it speaks to our teaching and user involvement as well. So it's really, for me, this is very easy to use, but I think that in order to have the students produce things that can be used in teaching, it has to be much more or closely developed together with teachers. And I just want to say a few words about the mountain that we have to change. Because there's these hundreds of learning outcomes. There's disciplines fighting for time on the curriculum. They're fighting among them, but there's also professors within each discipline fighting for time. And they have been, I mean, conflicts have resolved and things are going as usual, but it's so difficult to change precisely because of all this processes going on, and there's no central or at least there is a central coordination, but there's very little. I say no, it's very little central coordination. So it takes a lot to move this mountain. So I think that it's important, and in light of these podcasts and the students' initiatives, that it's important to combine both bottom-up and top-down alternatives, and that we should go from listening to students to empower them to help us change the curriculum. I think that students here are crucial because they are the ones who sit there listening to everything that we deliver. And it's, I mean, unless we're going to spend 6 years sitting down on every lecture, we have to use them and to involve them. So what can we do? I mean, I think we should actually, these are only some suggestions. One possibility is actually to sit down and take notes, arrange focus groups, and collaborate with teachers along the way. But, and that is important, that has to be, I mean, the results of such settings should be used as a foundation for top-down initiatives, because without these top-down initiatives, nothing would change. Also, I mean, I'm really into the sustainability agenda, but even for me, as an undervisningsleder in my topic, which is about everything about, you know, society and medicine, it's really difficult because I have to make all the compromises with my teachers. So you also need top-down initiatives. But congratulations with the opening of this really important center. I look so much forward to collaborating with you, and I'm so grateful that you have taken the work to ask or to get this funding, and for involving the students, and to the 4 students. I mean, you're amazing. Thank you.